As a geriatric physician here in the US, I've seen firsthand how staying active can truly transform the health and quality of life for folks over 60. Bhutan, this is critical. Not every workout is safe for older adults. In fact, the American Heart Association reports that adults over 60 account for over 40% of hospitalizations due to exercise-related cardiac events. And according to the CDC, nearly 800,000 Americans suffer a stroke each year, with age being one of the biggest risk factors. That's why certain high-intensity or high-impact exercises can actually raise your chances of heart strain, blood pressure spikes, or even life-threatening strokes if you're over 60. So in today's video, I'll share 6 specific exercises older adults should avoid to help protect your heart, keep your blood flowing smoothly, and lower your stroke risk. Before we dive into all the details, don't forget to like, share, and subscribe to Elderly Health Tips. Let's move on to the first risky exercise, deadlift. As a geriatric physician who's been practicing for over 35 years, I've seen countless older adults eager to keep lifting weights because they want to stay strong and independent. And that's fantastic. We want people moving. But deadlifts, in particular, are a whole different animal for folks over 60. According to a study in the Journal of Strength and Conditioning Research, 2011, heavy deadlifting can cause systolic blood pressure spikes ranging from 250 to over 345 millimeter G in healthy lifters. That's nearly double the normal resting systolic pressure of around 120 millimeters G. Why does that matter? Because as we age, our arteries tend to stiffen. The American Heart Association reports that about 70% of adults age 60 and older have some level of hypertension. When your blood pressure shoots up that high during a lift, it puts enormous strain on blood vessel walls, raising the risk of aneurysm, stroke, or even retinal bleeding. And it's not just your cardiovascular system. The American Academy of Orthopedic Surgeons warns that lumbar disc herniations are significantly more common after age 50, often triggered by bending and lifting motions. Deadlifts are a perfect storm. They involve a heavy load, spinal flexion, and a lot of intra-abdominal pressure. One of my patients, Bill, age 67 from Chicago, thought he could deadlift like he did in his 30s. He was pulling 185 pounds off the floor when he felt a sudden pop in his lower back. Turns out he had a large L4-L5 disc herniation compressing his sciatic nerve. According to the National Institutes of Health, people over 60 have a 4 times higher risk of complications and slower recovery after a disc herniation compared to younger adults. Another risk, balance. The CDC reports that 1 in 4 Americans over 65 falls every year, and falls cause over 36,000 deaths annually in this age group. Deadlifts, especially heavy ones, challenge your balance. If you tip forward or backward while holding a loaded barbell, you're at major risk for a fall. Instead of traditional deadlifts, here's what I recommend. Try dumbbell Romanian deadlifts with very light weight. Think 10 to 15 pounds max and only partial range of motion. This reduces spinal compression and helps maintain hip mobility. Practice hip hinge movements without weight to keep your core strong. Studies from the National Institute on Aging show that maintaining proper hip mechanics reduces lower back injuries in older adults by over 40%. Use seated leg presses instead of deadlifts. According to research in the Journal of Geriatric Physical Therapy, 2016, resistance machines like leg presses significantly improve lower body strength in seniors without increasing injury risk. Don't hold your breath during lifts. This is called the Valsalva maneuver, and it's one big reason blood pressure skyrockets. Always exhale as you exert force. The American Heart Association suggests that controlling breathing during lifting can keep systolic pressure up to 30% lower. Exercise number 2, sprinting. Here's a fact that might shock you sprinting. Those quick bursts of running can push your blood pressure so high that it's almost the same as someone in a medical crisis. And for people over 60, it could be a hidden trigger for heart attacks or strokes. Let's break this down. Speaking as a geriatric doctor who's been practicing for more than 35 years, I can tell you exercise is crucial as we age. But not all exercises are created equal. Sprinting is one of the most demanding things you can do for your heart and blood vessels, especially as you get older. Here's why. When you sprint, your body demands oxygen fast. Your heart has to pump harder and faster, and your blood vessels need to expand quickly to handle the flow. The American College of Sports Medicine reports that during sprints, your heart rate can reach 90–95% of your max heart rate in just seconds. For a 65-year-old, that might mean hitting 160, 170 beats per minute, way higher than a moderate pace. But the real danger is blood pressure. A study in the Journal of Hypertension, 2012, found that systolic blood pressure during maximal effort exercise can spike to over 210 millimeters G in older adults. And the American Heart Association warns that such spikes are risky for people with stiff or narrowed arteries, which is common after 60. Why is that a problem? Because many older adults have silent atherosclerosis, those plaque buildups inside their arteries. According to the CDC, about half of Americans over 60 have significant plaque in their coronary arteries or carotid arteries, even if they feel fine. During a sprint, the force of high blood flow can rupture one of those plaques. When a plaque bursts, the body quickly forms a blood clot to patch it, but if that clot blocks a coronary artery, you'll have a heart attack. If it blocks an artery in the brain, it causes an ischemic stroke. The National Heart, Lung, and Blood Institute, NHLBI, reports that about 70% of heart attacks are caused by plaque rupture, and that sudden, intense exercise is one known trigger. One of my patients, Ron, age 68 from Florida, used to jog 3 miles every morning. One day, he decided to start sprinting the last 100 yards of each lap. After just 2 sprints, he felt severe chest pain and collapsed. In the ER, doctors diagnosed him with a non-ST elevation myocardial infarction. The cardiologist believed the sudden surge in blood pressure from sprinting ruptured a plaque in his coronary artery. This isn't rare. A study in Circulation, 2015, found that about 6% of heart attacks in people over 55 were triggered by sudden intense physical exertion, like sprinting or heavy lifting. And the risk increases dramatically in those with high blood pressure or cholesterol. It's also about strokes. The American Stroke Association estimates that 1 in 4 strokes occurs in people who've had no prior warning signs. Sudden spikes in blood pressure can rupture small blood vessels in the brain, leading to hemorrhagic stroke bleeding inside the brain. The National Institute of Neurological Disorders and Stroke reports that intracerebral hemorrhage risk increases by over 50% in people over 65 with hypertension who engage in high-intensity exercise. Practical alternatives and safer options. Instead of sprinting, try brisk interval walking. Walk at a comfortable pace for 2 minutes, then slightly increase your pace for 30 seconds. Studies from the Journal of Aging and Physical Activity, 2019, show that interval walking can improve cardiovascular fitness by 13% in seniors without risky blood pressure spikes. Try a stationary bike or elliptical at moderate resistance. The Mayo Clinic reports that low-impact cardio can maintain heart health while keeping blood pressure 20–30% lower than during running sprints. Always warm up for at least 5–10 minutes before exercise. A good warm-up reduces the chance of sudden blood pressure spikes by as much as 20%, according to the American Heart Association. Pay close attention to how you feel. Stop immediately if you notice chest pain, unusual shortness of breath, dizziness or faintness, pressure or pain in your neck, jaw, or arms. These could be signs of a serious heart problem. Exercise number 3, deep squats. Here's a surprising truth doing deep squats. With heavy weight can slam your knees with over 7 times your body weight and send your blood pressure soaring into dangerous territory, especially if you're over 60. Let's dig into why this exercise might be riskier than you think. First, let's talk about joint stress. When you squat deeply, meaning your hips drop below your knees, you dramatically increase the force across the knee and hip joints. The American Academy of Orthopedic Surgeons, AAOS, notes that deep squats can produce forces equal to 6–7 times body weight on the knee joint. So, If someone weighs 180 pounds, their knees could be handling over 1,200 pounds of pressure in that low position. Why does that matter? Because cartilage in the knee naturally thins as we age. Studies from the National Institutes of Health, NIH, show that about 45% of people over 60 have some degree of knee osteoarthritis, even if they're not feeling symptoms yet. Deep squats can accelerate cartilage breakdown, increasing pain and swelling. In fact, the CDC estimates that 1 in 3 adults over 65 is living with diagnosed arthritis. And high-load exercises like heavy deep squats can make it worse, leading to increased joint stiffness and reduced mobility over time. Heavy squats, especially deep one, increase intra-abdominal pressure dramatically. This happens because many people hold their breath during the lift, the Valsalva maneuver, to stabilize their spine. But here's the problem. A study in the Journal of Strength and Conditioning Research, 2013, found that deep squats with heavy weights can spike systolic blood pressure over 300 millimeter G for a few seconds. That's more than double normal resting levels and even higher than some hypertensive crisis readings. According to the American Heart Association, these sudden spikes can strain the heart, increase the risk of a burst blood vessel, aneurysm, or even trigger a heart attack or stroke, especially in people with pre-existing hypertension or stiff arteries. And hypertension is common. About 70% of adults over 65 in the US have high blood pressure per Candela C data. And it's not only your heart at risk. The National Institute on Aging reports that excessive intra-abdominal pressure can also increase the risk of abdominal hernias, common in older adults, small blood vessel ruptures in the eyes, causing sudden vision issues, fainting episodes from sudden drops in blood flow to the brain, practical alternatives and safer tips. Instead of deep squats, try quarter or half squats. Research in the Journal of Orthopedic and Sports Physical Therapy shows partial squats still engage the same muscle groups while reducing knee stress by 40–50%. Swap deep barbell squats for chair squats. Simply sit back onto a sturdy chair, then stand up. It's much gentler on the knees and hips and easier to keep your balance. Use lighter weights. Studies show that older adults can achieve nearly the same muscle strength gains with lower weight and higher repetitions as with heavy lifting. It's safer for joints and keeps blood pressure from skyrocketing. Always breathe out during the lift instead of holding your breath. The American Heart Association reports that proper breathing during strength exercises can keep systolic blood pressure up to 30% lower. Exercise number 4, one-arm push-ups or plyometric push-ups. Let's start with cardiovascular strain. Plyometric push-ups, where you explosively launch your hands off the floor, increase the demand on your heart extremely fast. A study in the American Journal of Cardiology, 2015, found that high-intensity upper body exercises can spike systolic blood pressure to 220 millimeters G or more in older adults. That's nearly double the normal resting systolic pressure of around 120 millimeters G. And here's why that's a problem. The American Heart Association reports that about 70% of Americans aged 65 and older have hypertension or stiff arteries. When blood pressure skyrockets during a sudden burst of exertion, it increases the risk of ruptured blood vessels, aneurysms, heart attack, myocardial infarction, stroke, especially hemorrhagic stroke. According to the CDC, high blood pressure is a leading risk factor for over 800,000 strokes a year in the US, and intense exercise like plyometric push-ups can be a trigger. One-arm push-ups and explosive push-ups load tremendous force on your shoulders, wrists, and spine. A study in the Journal of Strength and Conditioning Research, 2016, showed that unilateral push-ups can increase shoulder joint torque and rotator cuff strain by 40–60% compared to regular push-ups. That's a huge increase, and it's especially risky for older adults whose joints and tendons are often weaker due to aging and decades of wear and tear. The National Institute on Aging reports that tendon elasticity declines with age. making older adults more prone to rotator cuff tears, tendonitis, joint dislocations. This risk skyrockets if someone already has osteoporosis, which is incredibly common. The National Osteoporosis Foundation estimates that 1 in 2 women and 1 in 4 men over 50 will experience an osteoporosis-related fracture in their lifetime. Falling forward during a plyometric push-up or collapsing from shoulder fatigue during a one-arm push-up could result in fractured wrists, broken ribs, collarbone fractures. One of my patients, Bill, 68, from Texas, was a former high school football coach who prided himself on being tough as nails. He saw a YouTube video of a younger guy doing plyometric push-ups and decided to give it a try. On his 4th rep, he lost his balance and crashed down, dislocating his right shoulder and fracturing his radius. The American Academy of Orthopedic Surgeons, AAOS, reports that shoulder dislocations in older adults often lead to chronic pain, instability, and a 30–50% chance of needing surgical repair. Another patient, Linda, 64, from California, tried one-arm push-ups because she wanted to prove she could keep up. Within a week, she developed sharp pain in her right shoulder. An ultrasound showed a partial rotator cuff tear. The Journal of Orthopedic and Sports Physical Therapy, 2018, notes that rotator cuff injuries account for up to 50% of shoulder pain complaints in people over 60. Exercise number 5 is also extremely risky. Inverted yoga poses. Speaking as a geriatric doctor for more than 35 years, I absolutely love yoga for older adults. It's fantastic for balance, flexibility, and stress relief. But inversions, where your body is upside down, can pose real dangers that many people simply don't realize. Let's start with blood pressure. When you flip upside down, gravity pushes blood towards your head and neck. According to a study published in the Journal of Hypertension, 2012, yoga inversions can cause systolic blood pressure to increase by 30 to 40 mmHg in older adults, even in people who start with normal readings. So if your usual systolic pressure is already around 140 mmHg, which is quite common in people over 60, that spike could push you up to 180 mmHg or more. Why is that a problem? Because the American Heart Association reports that nearly 70% of adults over 65 have hypertension or some degree of arterial stiffening. When blood rushes into the vessels of the brain under high pressure, it raises the risk of aneurysm, rupture, bursting of a weakened blood vessel, hemorrhagic stroke, bleeding inside the brain tissue. The American Stroke Association states that about 15% of all strokes are hemorrhagic, and sudden blood pressure spikes from exertion or head-down positions are a significant trigger. Worse, aneurysms often show no symptoms until they burst. Inversions demand significant neck strength, shoulder stability, and core control. But older adults often experience age-related changes that make these moves risky. A report from the National Institute on Aging, NIA, shows that muscle mass decreases about 3 to 8% per decade after age 30, accelerating after age 60. Less muscle means weaker balance and poorer joint protection. A study in the Journal of Geriatric Physical Therapy, 2018, found that older adults have 35% slower reaction times when correcting their balance. So when someone starts tipping over during a headstand, it's harder to catch themselves, leading to dangerous falls. The CDC reports that falls are the leading cause of injury-related deaths among Americans over 65, accounting for more than 36,000 deaths annually. And falling out of a headstand or shoulder stand dramatically raises the risk of cervical spine fractures, concussions, rotator cuff tears, or shoulder dislocations. Practical alternatives and safer tips. Instead of full inversions, try legs up the wall pose, Viparita Karani. This gentle position lifts your legs while keeping your head and neck on the ground. Studies from the National Center for Complementary and Integrative Health, NCCIH, show this pose can lower stress and reduce swelling in the legs without spiking blood pressure. Avoid any pose that puts full weight on the neck, especially if you have arthritis, disc problems, or past neck injuries. The AAOS warns that neck-loading poses can exacerbate spinal degeneration in older adults. Practice inversions only under supervision with a qualified yoga instructor who understands senior modifications. Always listen to your body. If you feel a sudden rush of pressure in your head, blurred or double vision, dizziness, neck strain, come out of the pose immediately. Those could be early warning signs of elevated blood pressure or restricted blood flow to the brain. Consider using props like bolsters or blocks to make transition safer and reduce strain. The Journal of Geriatric Physical Therapy reports that using props can reduce fall risk by over 40% in older adults practicing balanced, challenging yoga poses. Exercise number 6, hanging exercises on a pull-up bar. Let's start with pressure inside your chest and abdomen. When you hang from a bar, your muscles tense up to keep you steady, and many people unconsciously hold their breath. This maneuver, called the Valsalva maneuver, causes pressure to build up inside your chest cavity, making it harder for blood to return to your heart. A study in the Journal of Strength and Conditioning Research, 2015, found that during high-intensity upper body exercises, such as pull-ups, systolic blood pressure can exceed 200 mm G in older adults, sometimes even reaching as high as 250 mm G. That's more than double the normal resting systolic pressure of around 120 mm G. This matters because the American Heart Association reports that about 70% of Americans aged 65 and older have high blood pressure. Such sudden spikes can lead to angina, chest pain, arrhythmias, irregular heart rhythms, risk of a heart attack or stroke. In fact, a study published in Circulation, 2015, showed that about 6% of heart attacks in older adults are triggered by sudden, intense physical exertion, including heavy upper body work. One risk I see in my older patients is postural hypotension. This is when your blood pressure drops dramatically when you shift positions. According to the National Institute on Aging, roughly 20% of adults over 65 have significant postural blood pressure drops. When you're hanging and then suddenly drop to the ground, gravity changes how blood circulates in your body. Blood that was concentrated in your chest and arms rushes downward, leaving your brain briefly deprived of enough blood flow. This can cause dizziness or lightheadedness, blurred vision, fainting, syncope, increased fall risk. A CDC report states that falls are the leading cause of injury-related death in adults over 65, responsible for more than 36,000 deaths per year. A fainting spell after coming off a pull-up bar could result in a dangerous head injury, broken bones, or worse. One of my patients, Bill, age 68 from Texas, wanted to get back in shape. He started adding hanging leg raises to his routine at the gym. After releasing the bar one day, he felt a sudden wave of dizziness, lost his balance, and hit his head on a weight bench. Thankfully, he didn't suffer a skull fracture, but he ended up with a mild concussion. Practical alternatives and safer tips. Try resistance band pull-downs instead of full body weight pull-ups. Studies in the Journal of Geriatric Physical Therapy, 2016, found that elastic bands can provide similar muscle activation in seniors without the dangerous blood pressure spikes seen in bodyweight exercises. Use assisted pull-up machines, which allow you to adjust how much of your body weight you're lifting. This reduces strain on your shoulders, chest, and cardiovascular system. Keep exercise sessions moderate. The American College of Sports Medicine recommends that adults over 60 perform moderate intensity resistance training 2 to 3 times per week for best benefits without overtaxing the body. Focus on breathing. Never hold your breath while pulling up. Exhaling during exertion can lower peak blood pressure by up to 30%, according to the American Heart Association. Warm up properly and cool down gently. Sudden changes in body position can be risky for older adults. A proper transition helps your circulation adjust safely. Friends, After going through these 6 exercises from deep squats and sprinting to one-arm push-ups, yoga inversions, hanging pull-ups, and heavy deadlifts, it's clear that staying strong as we age is important, but staying safe is even more important. We don't have to stop moving, we just have to move smart. Listen to your body, respect your limits, and choose exercises that keep your heart, joints, and balance protected so you can keep living life to the fullest. So, I hope today's tips help you or someone you love avoid unnecessary risks and still stay fit, healthy, and confident. If you found this helpful, please like this video, share it with your friends, and don't forget to subscribe to Elderly Health Tips for more simple, practical advice to keep you strong and safe every day. You deserve to enjoy your best years with health and peace of mind.